Before we even submitted our proposal, we were asked, why would you focus on menstrual health in emergencies? It's not really a priority. And why focus on people with intellectual disabilities? Perhaps these are questions you are asking yourself. I'm Chloe Morrison, and today with my colleague, Dr. Jane Wilbur, we'll be sharing about how important this topic is and how you too can address it in emergencies. So while there is growing recognition that menstrual health is a fundamental aspect of humanitarian response, people with disabilities, especially those with intellectual disabilities, are inadequately considered in delivering such efforts, which is highlighted in our systematized review, which is published online. So moving on to our most recent study I've been working on, which is based in Vanuatu. And for those of you not familiar with the Pacific, Vanuatu is a small island state in the Western Pacific, and it regularly experiences extreme weather events. In March 2023, last year, Vanuatu was hit by twin cyclones within days of each other. I'll now pass to Jane to share more about our intervention and project.
The Vanuatu campaign is a menstrual health intervention for people with intellectual disabilities and their caregivers during Vanuatu's emergencies. This is Vanuatu, a young woman with an intellectual disability, and Voto Vanuatu, who is her caregiver standing behind her. And these two characters are the faces of the campaign. Vanuatu has just started menstruating, and Voto Vanuatu is supporting her to understand what's happening and how to manage it as independently as possible. The Vanuatu campaign uses these characters to support people like these two to do the same. And the campaign was adapted from the Bishesta campaign in Nepal, and that was designed for the development setting. This work is funded by ELRA's Humanitarian Fund. The campaign includes 2 training modules, and across these, we worked with young women with intellectual disabilities and their caregivers to increase communication about menstruation and understanding about how to manage it hygienically and with dignity. We used several resources called period packs to help do that, and the period packs were designed to make menstrual health behaviours attractive and easy to adopt, and they are given out to the young people. Contents a large menstrual storage bag that includes reusable menstrual materials. Those are the photos on the left and the bottom. And also a menstrual bin, which is the photo on the right. And the young people put the used menstrual materials in the bin, and then they either empty it or the caregiver empties it, washes, dries it for reuse. They're also given a small drawstring bag, which is the photo at the top, and that's so people can put some menstrual material in it and leave the home if they are on their period. They have a spare menstrual material with them. We also gave out visual stories to the young people, and these depict Vanuatu menstruating for the first time, her father and Voto Vanuatu supporting her to understand menstruation and how to manage it hygienically, how to prepare for an emergency and evacuate during a cyclone with her period pack. So that's the image in the top centre of the family evacuating. And you can see that Vanuatu is carrying her large menstrual storage bag and her bin. The caregivers are given a calendar so that they can track the young person's menstrual cycle and therefore prepare for the next one. During the training, we used a Vanuatu doll to introduce the period packs and how to use them before the young person took them home. The doll on the photo has removable clothes, underwear, and a menstrual material, so the young person can practice putting the material on, removing it, putting it in the bin, washing hands, and redressing. We delivered it to 30 young women with intellectual disabilities and their female and male caregivers. It was delivered by a team of women with and without disabilities, and it was done through house-to-house delivery. COVID-19 and cyclones hit while we were doing the delivery, so it proved to be a good testing site. We carried out a feasibility study to assess the campaign's feasibility and acceptability to help us understand if it's worth more investment in the future. To do this, we used qualitative data collection tools These were process monitoring tools, post-intervention in-depth interviews with caregivers and 9 young people, observation of the young person, photo, voice and ranking with 2 young people, and campaign resource ranking. So people were able to rank the contents of the period pack according to which they were more likely to take during when evacuating during a cyclone. And we were able to compare those findings with the previous formative research that we did, because we used similar tools to gather information on pre-intervention. We also interviewed staff involved in the intervention development and delivery and humanitarian workers in Vanuatu.
So what did we find? We found that the Vavanua campaign was feasible and acceptable for young people, caregivers, facilitators, and practitioners. Improvements were recorded and reported across all target behaviours. Many young people are managing menstruation more independently, as you can see from this quote on the screen from Pania, a female caregiver. Just to note that all of the quotes that we're sharing are using pseudonyms throughout our research and our presentation. So she shared, "The last month was the first time we slept and she went to the toilet and she saw her period and took her towel and went to bathe. I saw a big change in her. It was the first time ever. It's helping her now." We found that adolescents understood the training and applied their learning, as you can see from the photo voice exercise on the screen. These 2 images are self-directed portraits by 2 adolescents with intellectual disabilities who took part in the campaign. The photo on the left is owned by Josephine, also a pseudonym, and the caption she chose is Dolly and Book. In it, she is sat looking at the visual story and holding the Vavanua doll. Phelan directed the self-portrait on the right. The caption is "Filling up my bag with calico," otherwise known as menstrual materials. This is another self-directed portrait by Josephine, and she captioned it, "I'm going to a house to hide in case a cyclone comes." And you can see Josephine is carrying her menstrual storage bag with her for evacuation. And this was a big change we saw in the feasibility study, with more and more households reporting they would evacuate in case of an emergency next time. Male and female caregivers reported they were better able to support the person's menstrual health. They said they were now better prepared for the next emergency. Humanitarian actors also reported wanting to scale up the campaign. So in summary, the Vavanua campaign worked in the Vanuatu context. In Vanuatu, World Vision Vanuatu, together with Relvie, a New Zealand not-for-profit organisation, secured funding from the New Zealand government, whilst World Vision Vanuatu also secured funding from UN Women to scale up the approach. Together with Vanuatu Society for People with Disabilities, World Vision has trained 18 facilitators across 5 wards in Port Vila and will roll out the training across the Whātei and Tana Islands. The Vavanua campaign has huge potential beyond Vanuatu. Now, what's next? It needs to be adapted, piloted, and evaluated in other humanitarian settings to benefit more people. So lastly, we produced a range of research papers and reports and how-to guides throughout the project. They're all available online and through open access. And of course, feel free to reach out to Jane or I should you have any questions or want to know more about the approach. Thank you.